All right, let's talk about something we all experience but maybe don't fully understand. You swallow a pill, and then what? Today, we're going to unlock the microscopic secrets of how medicines really work. Let's get into it.
I mean, think about it. It's kind of wild, right? You've got a headache, you take a pill, and somehow it knows to go to work on the pain in your head and not, your big toe. How on earth does it know where to go and what job to do?
Well, the secret is actually a beautifully simple and powerful analogy that explains pretty much everything. Almost everything a drug does in your body, whether it's for pain or allergies, boils down to this one concept: a tiny key fitting into a tiny lock. Okay, so to understand how the drug, our key, works, we have to start with the lock it's designed for. And in our bodies, these molecular locks are called cellular receptors. Just imagine your cells are like little houses, and each house is covered in thousands of very specific, very unique keyholes. These keyholes are the receptors. They're basically just sitting there waiting for the right signal, the perfectly cut key to tell the cell what to do next. And these aren't just any old locks. They are incredibly precise. They have three main properties that make them so good at their job. First, they're super sensitive, which means you don't need a huge number of keys to get a response. They're also highly selective. This is crucial, making sure the key for your headache doesn't accidentally unlock a cell that controls your blood pressure. And finally, they have specificity. That means turning a specific lock always, and I mean always, triggers the exact same action. No surprises. So we've got the locks down. Now let's talk about the other half of this partnership, the key itself. In pharmacology, the key that fits the lock and makes something happen is called an agonist. You can think of the agonist as the hero of our little story. It's the drug, or even a natural chemical your body already makes, that finds its perfect receptor match, fits in just right, and successfully turns the lock to kickstart an action. It gets the job done. And this whole process happens in 3 quick steps. First up is binding. The key finds its one and only keyhole. Simple enough. Second is activation. As that key turns, it physically changes the shape of the lock, the protein. That tiny shift in shape is everything. It's what starts the whole chain reaction. And that leads us to step 3, the response. That shape change triggers a cascade of events inside the cell, which ultimately gives you the effect you're looking for, like your headache finally going away. But here's a question. What if a drug's job isn't to start something, but to stop it? Well, for that, you need a totally different kind of key, one that's designed to jam the lock. And this is where the antagonist comes in. Okay, so an antagonist has what we call affinity. That just means it's shaped perfectly to fit right into the keyhole. But it has no efficacy. It's missing the special grooves needed to actually turn the lock. So what does it do? It just sits there blocking the keyhole. So the real key, the one that causes the unwanted problem, can't get in. It's a professional blocker. So let's just break that down one more time, side by side. The agonist and the antagonist both fit the lock, but here's the difference. The agonist turns it, causing an action. The antagonist just blocks it, preventing an action. It's a simple but profound difference between turning and blocking, and it's the foundation for so many medicines. And this is exactly how a ton of common medications work. Think about an allergy pill. Its whole job is to be an antagonist, to go in and jam the histamine locks so that chemical causing your runny nose and itchy eyes can't get in to do its work. The drug isn't creating some new effect, it's just stopping an unwanted one, dead in its tracks. Okay, so we've got our locks, and we have keys that can either turn them or jam them. But if the basic science is the same, why does the exact same drug, at the exact same dose, affect you and me so differently? Well, when a drug company develops a new medication, the standard dose they recommend is based on the average response they see across a huge population. You get this classic bell curve. The dose is designed for that theoretical average person right there at the peak of the curve. The thing is, most of us aren't exactly average, are we? So to figure all this out, scientists identify 2 really important numbers. First, there's the effective dose, or ED50. That's the dose that actually works for 50% of people. But they also have to find the toxic dose, the TD50, which is the dose where 50% of people start to experience harmful side effects. And the whole goal is to find a dose that's way, way far away from that second number. The space between those 2 points, where it works and where it becomes harmful, is called the therapeutic window. This is the sweet spot. It's the target range where your doctor is trying to get your dosage to land. It's where the key works great without doing any damage to the lock or the house. So why is your therapeutic window totally different from someone else's? Well, it's about everything that makes you, you. Your genetics can literally change the shape or number of your receptor locks, making a standard key a perfect fit for one person, but maybe a little loose for another. Your overall health, any existing pathology, can change how your body processes a drug. And of course, things like your age, your body weight, and your sex all influence how a drug gets distributed and how long it hangs around in your system. Bottom line, no two systems are ever exactly alike. And that really brings us to the future of all this. With the incredible rise of pharmacogenetics, which is the study of how your specific genes affect your response to drugs, we're getting closer and closer to a world of truly personalized medicine. So you have to wonder, will we get to a point where your prescription isn't based on an average anymore, but is tailored precisely to your unique set of locks? A key cut just for you.